Uh, it's a debate on dry eye, role of investigation, and I don't have anybody to debate with, so I'm going to debate with my alter ego, a demon inside who tells me that there's no need for an investigation, and well, a good person inside tells me that we must investigate. Let's see who wins. I don't have financial disclosure. I wish I had some financial disclosure, but unfortunately, I still don't have. Uh, so the question is that why do we need to investigate if we are still putting the lubricant drop, and what's the need of investigation? There's actually, you're not going to do any different treatment. The interesting part are that whatever we are doing about dry eye, whether it's classification of dry eye, aqueous, evaporative, are we actually classifying dry eye based on the root cause? No, we are classifying dry eye based on effect. Whether treatment, you use different lubricants, different strategies, are we actually treating the root cause of dry eye? No, we are treating the effect of the dry eye, not the root cause. So does that mean all dry eye are same? Certainly not. We all know that dry eye related to rheumatoid arthritis and dry eye related to MGD would not be same. It cannot be same. So should we treat all the dry eye same way? Rather than that, actually we should be treating the root cause and not just the effect of the dry eye. But the other argument is that, well, we do treat dry eye, and I use investigation modalities like Schirmer strip, Lissaman green, rose bengal. I do TBUT also. So why do I need anything else? The rest everything is just industry pressure. Why do I need to buy instrument? And there would be new instrument coming every day. Well, I agree that the dry eye diagnostic gold standards are questionnaires, symptom questionnaires, quality of vision, ocular surface staining, TFM breakup time, Schirmer's, and that's the gold standard. But all these tests, are we diagnosing root cause? Well, we are not diagnosing root cause. We are just diagnosing the effect of that problem, right? So if we want to treat the root cause, we need to understand the pathogenesis of dry eye, and just treating the dry eye would not help, but we need to treat the root cause. So when we want to investigate, there are so many things, and rather I would say this list holds true for anything which, any instrument which you want to buy. So when you want to buy an instrument for dry eye here, it should either help in diagnosis, it should help you to decide about the severity of disease, or it should help in treatment, it should have good repeatability, should have good sensitivity and specificity, and should be good value for money. When we go through all our investigation modality through this kind of list, it helps us in diagnosing whether we can use that modality or not. So talking about what investigative modality we should use, well, if we look at the pathogenesis, we know one of the most important thing which has been highlighted recent years is hyperosmolarity. There are plenty of literature about this thing, and now we also have an instrument which can detect the osmolarity by doing osmometry, what we call, from Teolab. Anything value which are more than 316, it's called hyperosmolar, and that's bad. But interesting part here is that when you do osmolarity checking in different people, there is huge variability from normal to abnormal, and more the abnormal, variability is higher. There are articles which show that from severe disease to mild disease, the range can be actually same. And not only that, from Sjogren's, non-Sjogren's, normal, all of them can have similar reading. So how would this thing help us in diagnosing? It certainly does not help us in diagnosis. Certain doesn't help us about severity of disease also, doesn't help us in treatment because we do not have hypoosmolar drops which can reduce this thing. At the most we can use maybe osmoprotection. It's certainly not good value for money, so not good for me. Another thing which has been highlighted recent years is inflammation and dry eye. And we know that there is complex theory of inflammation, white inflammation, and there are many inflammatory mediators. Among them, MMP9 has been shown and studied widely, where it shows that MMP9 levels are pretty significantly high in dry eye compared to the non-dry eye patients. Now we have a small test which is something similar to a pregnancy test, and where it can give you a lab diagnosis right at your clinic, and within few minutes we can check whether the patient has high MMP9 level or not. The test is very simple. We take the sample from the lower tarsal region, and there we have the result which tells us whether the MMP9 levels are more than 40 nanogram per milliliter. So how does this help? Well, when we check MMP9 level, and if we find MMP9 levels are very high, we need to treat these patient with anti-inflammatory molecules like cyclosporin, tacrolimus, steroid, and rest we may avoid this thing, and we may be fine. So if you look at this thing, does it help in diagnosis? Maybe it can tell us about MMP9. Does it help in severity? Maybe severe disease, more MMP9. Yes, okay. Does it help in treatment? Certainly. If MMP9 levels are high, we are going to use anti-inflammatories. Is it good sensitivity, specificity? It does have, and good value for money. 1,000 rupees cost may not be very bad. So certainly you can think about this thing as one of the investigating modality. Pathogenesis of dry eye, the last part is TFM instability, and recent years we have been listening about a lot of things about MGD. We know that we have been taught from really long time that blepharitis, MGD, blocked meibomian glands, warm compresses, lid massage. So when we have blocked glands and when we have lipid layer abnormality, there can be things like LipiView which can show us the lipid layer and can tell us whether the lipid layer is present, normal, abnormal, about blink and everything. The problem with the machine is it has poor repeatability. It does not have very good specificity, sensitivity. Hence, if you go by the list, it's certainly not something where I would want to waste my money on. Another instrument which also gives us a lot of things is keratograph, which is essentially a topographer, placidose-based topographer, but it gives us non-invasive TFM breakup time, tear meniscus, pupillometry. It takes wonderful diffuse picture, and it takes one of the best fluorescent picture with Ratten filter and gives very nice dry eye report. It does meibography, and by meibography we know the visualization of meibomian gland. It shows us if there are drop glands. This is meibography of my own mother. She kept on complaining about dryness, and I kept on telling about warm compressed lid massage till I saw this thing that she didn't have meibomian glands left. So whatever I do, it's not going to help. Well, we don't need to buy such instrument. I had been doing meibography for a really long time using my autorefractometer also. Anything which has infrared source, you can try it out and one of the instrument may work. So why do we need meibographer or meibography? Well, when we have blocked meibomian glands, the conventional teaching is that we do warm compresses, lid massage. But then if you do meibography and if you find the glands are there, this is going to work. But if glands are lost, even if we jump on the eye, nothing is going to come out. So it doesn't have much role. So if we look at this thing, this instrument, does it help in diagnosis? Certainly. Does it can you decide about the severity of disease, treatment, repeatability? Everything works. It's certainly worth money. So similarly, the quality of vision is another thing which we talk about when we talk about dry eye diagnostic. One of them is our aberrometer eye trace, which shows you if there are any hard or aberration related to dry eye. Once you treat it, the aberrations reduce. So if you again go through the list, you'd realize that it's not worth buying instrument for dry eye, but if you already have it in your OPD, well, you can actually use it for the dry eye diagnostic. So standalone, I won't buy it. Another new kid on the block is ocular surface analyzer, which does similar thing to what I described earlier, meibography, non-invasive TFM breakup time, white to white. So looking at all these things, I would certainly bet my money on this kind of instrument. So yes, I would buy such instrument. So to summarize, not all the dry eyes are same. Treatment of dry eye should be customized based on the root cause, and various investigating modality can help us to find out these root cause. We must appropriately investigate all the dry eyes. Thank you very much.